Doctor of Osteopathic Medicine is a professional doctoral degree for physicians and surgeons offered by medical schools in the United States. Holders of the DO degree have attained the ability to become licensed as osteopathic physicians who have equivalent rights, privileges, and responsibilities as physicians with a Doctor of Medicine degree. DO physicians are licensed to practice the full scope of medicine and surgery in 65 countries, including all 50 states in the U.S., and make up 7% of the total U.S. physician population. In 2013, there were 87,300 osteopathic physicians in the United States. Currently, there are 30 medical schools with 42 locations throughout the United States that offer the DO degree, and 141 medical schools that offer the MD degree. As of 2011, 1 in 5 medical students in the United States were DO students. The curricula at osteopathic medical schools are very similar to those at MD-granting medical schools. 4 years in total length, the first 2 years of medical school focus on the biomedical and clinical sciences, followed by 2 years of core clinical training in the clinical specialties. Upon leaving medical school, DO graduates may enter internship or residency training programs, which may be followed by fellowship training. Many DO graduates attend the same graduate medical education programs as their MD counterparts, and then take MD specialty board exams, while other DO graduates enter osteopathic programs and take DO specialty board examinations. One notable difference between DO and MD training is that DO training adds €300 500 hours studying philosophically based techniques for hands-on manipulation of the human musculoskeletal system. These techniques, known as osteopathic manipulative medicine, have been criticized as pseudoscientific. History. The practice of osteopathy began in the United States in 1874. The term osteopathy was coined by physician and surgeon Andrew Taylor Still, M.D., who Still named his new school of medicine osteopathy, reasoning that the bone, osteon, was the starting point from which he was to ascertain the cause of pathological conditions. Still founded the American School of Osteopathy in Kirksville, Missouri, for the teaching of osteopathy on May 10, 1892. While the state of Missouri granted the right to award the MD degree, he remained dissatisfied with the limitations of conventional medicine and instead chose to retain the distinction of the DO degree. In 1898 the American Institute of Osteopathy started the Journal of Osteopathy, and by that time 4 states recognized the profession. The osteopathic medical profession has evolved into 2 branches: non-physician manual medicine osteopaths who were educated and trained outside the United States, and U.S.-trained full scope of medical practice osteopathic physicians. The regulation of non-physician manual medicine osteopaths varies greatly between jurisdictions. In the United States, osteopathic physicians holding the DO degree have attained the same rights, privileges, and responsibilities as physicians with a Doctor of Medicine degree. These groups are so distinct that in practice they function as separate professions. As originally conceived by Andrew Still, the letters DO stood for Diplomate in Osteopathy, and the title conferred by the degree was Doctor of Osteopathy. Subsequently the degree also came to be entitled Doctor of Osteopathic Medicine, and in more recent times the AOA has preferred that this title be used exclusively, resolving in a 1960 conference. Be it resolved, that the American Osteopathic Association institute a policy, both officially in our publications and individually on a conversational basis, to use the terms osteopathic medicine in place of the word osteopathy and osteopathic physician and surgeon in place of osteopath. The words osteopathy and osteopath being reserved for historical, sentimental, and informal discussions only. Nevertheless, some DOs continue to use the old terms, and the American Academy of Osteopathy retains the old usage in its name. Demographics. In 2013, there were 87,300 osteopathic physicians in the United States, of which 73,074 were in active practice. The proportion of females in the profession has steadily increased since the 1980s. In 1985, about 10% of DO physicians were female, compared with 34.6% in 2013. Between 2008 and 2012, 49% of new DO graduates were females. During the 2011 December academic year, the osteopathic medical student body consisted of 69% white non-Hispanic, 19% Asian or Pacific Islander, 3.5% Hispanic, 3% African American, and 0.5% Native American or Alaskan. The remainder were listed as other or not entered. Education, training and distinctiveness. Osteopathic medical school curricula are virtually identical to those at schools granting the MD degree. Once admitted to an osteopathic medical school, it takes 4 years to graduate, and the schooling is divided into the preclinical and clinical years. The preclinical years, the first and second years, focus on the biomedical and clinical sciences. The clinical years, the third and fourth years, consist of core clinical training and sub-internships in the clinical specialties. Osteopathic medical school accreditation standards require training in internal medicine, obstetrics gynecology, pediatrics, family practice, surgery, psychiatry, emergency medicine, radiology, preventive medicine and public health. According to Harrison's Principles of Internal Medicine, the training, practice, credentialing, licensure, and reimbursement of osteopathic physicians is virtually indistinguishable from those of physicians with MD qualifications, with 4 years of osteopathic medical school followed by specialty and subspecialty training and board certification. However, DO schools provide an additional €300 hours in the study of hands-on manual medicine and the body's musculoskeletal system, which is referred to as osteopathic manipulative medicine. The DO physician Brian E. Bledsoe, a professor of emergency medicine, has written disparagingly of this element of DO training. He characterized its foundations as pseudoscientific and asked, why members of the osteopathic medical profession continue to teach an outdated and ineffective system of healthcare to undergraduate osteopathic medical students. After completing medical school, DO physicians begin graduate medical training. Many DO physicians attend the same internship and residency training programs as their MD counterparts, and then take MD specialty board exams while other DO graduates enter osteopathic internships and residencies and take DO specialty board examinations. In 2003 QuackWatch published an article which stated that although most DOs offer competent care, the percentage involved in dubious practices appears to be higher than that of MDs. In particular, QuackWatch characterized some types of cranial therapy as dubious. In 2010, Steven Salzberg wrote that although he considered some DOs to be very good doctors, osteopathic manipulative treatment was promoted as the element that makes DOs special, and that it amounted to no more than extra training in pseudoscientific practices. Examinations. To be considered for entry into a DO program, an applicant must complete a national standardized exam called the Medical College Admissions Test. Some authors note the differences in the average MCAT scores in grade point average of students who matriculate at DO schools versus those who matriculate at MD schools within the United States. In 2011, the average MCAT and GPA for students entering US-based MD programs were 31.1 and 3.67, respectively, and 27.1 and 3.51 for DO matriculants, although the gap has been getting smaller every year. DO medical schools are more likely to accept non-traditional students who are older and entering medicine as a second career, or coming from non-science majors. DO medical students are required to take the comprehensive osteopathic medical licensure examination, which is sponsored by the National Board of Osteopathic Medical Examiners. The COMLEX USA is a series of 3 osteopathic medical licensing examinations. The first 2 steps of the COMLEX USA are taken during medical school, and are prerequisites for osteopathic residency programs, which are available in almost every specialty of medicine and surgery. The Step 3 portion of the COMLEX is taken during residency. In addition to the COMLEX USA, DO medical students may choose to sit for the MD board examinations, which are called the United States Medical Licensing Examination. This is typically done if the student desires to enter an MD residency. However, this is not always required. as some MD residency programs do not require the USMLE from DO applicants. USMLE pass rates for DO and MD students in 2012 are as follows: Step 1, 91% and 94%, Step 2 CK, 96% and 97%, and Step 2 CS, 87% and 97%, respectively. Step 3, 100% and 95%. Licensing and board certification. To obtain a license to practice medicine in the United States, medical students must pass the comprehensive osteopathic medical licensing examination, the licensure exam administered by the National Board of Osteopathic Medical Examiners throughout their medical training. Students are given the option of also taking the United States medical licensing examination to apply for some accreditation council for graduate medical education residency programs. Those that have received or are in the process of earning an MD or DO degree are both eligible to sit for the USMLE. Because of their additional training, only holders of the DO are eligible to sit for the COMLEX. Upon completion of internship and residency requirements for their chosen medical specialty, and depending on whether the program attended as ACGME or AOA accredited, holders of the DO may elect to be board certified by either a specialty board or an osteopathic specialty board. In February 2014, the American Osteopathic Association and the Accreditation Council for Graduate Medical Education agreed to unify allopathic and osteopathic graduate medical education starting in 2020. Depending on the state, medical licensure may be issued from a combined board or a separate board of medical examiners. All of the 70 state medical boards are members of the Federation of State Medical Boards. International variations. Currently, there are no osteopathic programs located outside of the United States that would qualify an individual to practice as an osteopathic physician in the United States. Foreign osteopathic degrees are not recognized by any state in the U.S. as being equivalent to American DO degrees. International practice rights. The following is an international licensure summary for U.S.-trained doctors of osteopathic medicine, as listed by the American Osteopathic Association. See also, List of medical schools in the United States, notes and references. External links, 1 DO's description on, what is a DO? Doctor of Osteopathic Medicine, National Institutes of Health.